together to help house the homeless amid the coronavirus shelter-in-place order in Georgia, which, by the way, Governor Kemp has partially lifted. Several charitable organizations teamed up with the city of Rome to convert a sports academy building into a new temporary shelter. Let's bring in the owner of that facility, Dr. John Cowan. He's a neurosurgeon who trained under HUD Secretary Dr. Ben Carson. So, Dr. Cowan, you are the owner of that sports academy building, and I understand you're leasing it for, what, $400 a month, which covers utilities. What's involved in converting this sports facility into a homeless shelter?
Sure. Thanks, Arthel, for having me. We saw the need in our local community and reached out to local leaders and the people who run our housing development authority, as well as the local homeless shelter, and came together to create a center that could house about 80 individuals, including families with children. So we really had to get a lot of people in the room. The Salvation Army is involved, the United Way is involved, and solve this problem that we were having.
Yeah, because there's a lot of choreography involved when you're trying to put together all the moving parts, you know, with the meals, the funding, the bedding, et cetera. So you put out the call and they came running. Is that what happened?
Well, that's right. The city was working on the problem, and as a local member of the Economic Development and the Community Foundation here, I heard about these problems, and I went to several of them and said, look, we've got a great space that's not being used because of shelter in place. What can we do to make it work? And we brought some construction folks in and added washing machines. We brought some cots in from the Salvation Army and brought in a few snacks and toys for the kids that would be there. And now currently we're housing 20 people. Like I said, we can house up to 80 if we need to.
And you said your main clientele, you've got single women and families there. And I saw the pictures of the beds that they seem to be, from what I can tell in the video, that they seem to be appropriately spaced. So tell us how else you're managing to keep social distancing there and to keep everybody involved from spreading or contracting coronavirus.
Sure. We have staff on site that's maintaining the social distancing between the folks who are staying there. Those cots that you saw in the pictures are 6 to 8 feet apart. We actually have separate rooms in the upstairs portion for families who had already been together to stay together and be separated. So we're doing a very good job. It's a very large facility. We have a lot of outdoor space where people can get outside and exercise as well. But they're taking temperatures of the people in there. We're wiping down surfaces, doing a lot of cleaning to make sure we can contain any possible spread.
Okay, very good. So you are running for Congress. So I want to ask you, how can we use this pandemic as a springboard for systemic nationwide change in how we feed the homeless, how we house the homeless, as well as provide mental counseling and medical assistance?
Well, that's a great question, and that's one I'm not going to be able to answer completely in 30 seconds or less, probably. But times like this, we've just seen the best in everybody, Republicans, Democrats, coming together and really solving problems. And I think if we keep that spirit where citizens of the United States recognize that we're all part of the same country and we're all affected by this virus, it doesn't matter your color, doesn't matter your political affiliation, that we all can be affected by it, our jobs are affected by it, and we have to work together going forward to solve these problems. And that begins in ramping up our supply chain of PPE, to detecting these viruses earlier, having a strong WHO that is looking out for these things and monitoring them carefully.
Right. And I understand, Dr. Cowan, that we have to work together. And I agree with what you just said. But again, you're running for office. So here's an opportunity. You're using your facility, which is a great thing that you're doing to help the homeless in your community. So maybe you could build from there and develop a platform that perhaps would be successful for you and could be shared across the country on how we deal with this problem of homelessness. And right now, it's growing because of people who are, for the first time, having to show up at shelters like yours for food and for shelter. It's a problem. So we need people like you who are running for Congress to come up with a platform to make this
That's
all
right.
better.
That's right. And we've got lots of people in our community working with these individuals, obviously job training, mental health counseling, just providing 3 meals a day for the children who are staying at our facility, making sure that when schools get back up or they're able to do distance learning at our facility, things like that. It's a big problem. And I'm looking forward, hopefully, to being a part of the solution, not part of any problems going forward.
Dr. John Cowan, thank you very much for joining us, and thank you very much for your efforts.